Everybody. So today we will take lymphatic drainage of head and neck. So what is lymph? Lymph is the tissue fluid or the interstitial fluid that enters the lymphatic vessels. It is transparent, it is yellowish in color, and you can see it has the alkaline function. Mainly it has WBC and that too the lymphocytes. That is why it is known as lymph. Lymph means it has lymphocytes and protein which are lesser than the plasma and fats. What is the main function of the lymph? This removes the bacteria from the tissue for immunity, removes bacteria from the tissue. So what is lymph? Lymph is derived from the blood itself, and lymph has lymphocytes. That means WBC, mainly the lymphocytes. And for revision, lymphatic system is absent in CNS, in cornea, in the superficial layer of skin, in the bones, alveoli of lung. So that is just for division. And now we come to the lymphatic drainage of head and neck. So what are the chief lymph nodes of the head and neck? They are arranged in three chains: superficial circular chain, a deep circular chain, and a vertical chain. The superficial circular chain has the group of lymph nodes which are extending from chin to the occiput. That means the submental, submandibular, the preauricular, the postauricular, the occipital. The deep circular chain has lymph nodes which are deeply situated around the larynx, trachea and pharynx. So the pretracheal group of lymph nodes, paratracheal, retropharyngeal and a Waldear's ring. Then there is a vertical chain which is extends in relation to the sternocleidomastoid around the internal jugular vein. So the vertical chain is the lateral cervical. If you see if you examine your sternocleidomastoid, so closer to the sternocleidomastoid, deeper to it lies the internal jugular vein. So on its sides and the external jugular vein. So the lateral cervical group of lymph nodes are present. So these are superficial external jugular vein, group of lymph nodes, external jugular group of lymph, and the deep group of lymph nodes, which are arranged along the internal jugular vein from digastric to the root of neck. These purple colors are the deep cervical group of lymph nodes. Anterior cervical group of lymph nodes are located anteriorly along the anterior jugular vein and along the larynx or the trachea as pretracheal group of lymph nodes, paratracheal group of lymph nodes, and the prelaryngeal group of lymph nodes. Now this is the upper horizontal chain of lymph nodes. If you see submental group of lymph nodes, here you can see submental group of lymph nodes. So what are the structure it is draining? It is draining the chin, the lower middle part of the lower lip, the tip of the tongue, and the efferents are going to submandibular group of lymph nodes and the internal jugular vein. The submandibular group of lymph nodes, they drain mainly the tongue, the upper lip, the cheek, the nose, the paranasal air sinuses, the orbits or the eye, the forehead, submandibular gland, sublingual gland, soft palate. All these are drained by the submandibular group of lymph nodes which are located in relation to the submandibular glands, and the efferents go to the internal jugular vein. And the parotid group of lymph nodes, they drain the scalp, the lateral part of the face, the buccal mucosa, and lymphatics here go to the external jugular vein of group of lymph nodes or the deep cervical group of lymph. Posterior auricular group of lymph nodes. So they drain the posterior part of the skull, posterior surface of the pinna, skin of the mastoid, and the lymphatics are drained to the efferents go to the internal jugular chain. So you can see all these groups which we have studied till now, the efferents from those lymph nodes drain to the internal jugular chain. Occipital group of lymph nodes, they are located in the apex of the posterior triangle, and they drain the scalp and the skin of the upper neck, and efferents go to the upper accessory chain of lymph nodes, which is located in the posterior triangle along the spinal accessory nerve. So if you brief for these group of lymph nodes, if you remember this diagram, you can remember the territory. Now this is the chin, the lower part of tongue, the tip of the tongue, the lower lip. This is for the submental group of lymph node. This is for submandibular group of lymph node. The nose, the eye, the forehead, the paranasal sinuses, the upper lip into the submandibular group of lymph node. And this, the lateral part of the face, the parotid region, the anterior surface of the pinna, the scalp, the angle of the mandible, these all drain into the parotid group of lymph nodes. Now if we come to the lateral cervical group of lymph nodes, they are arranged superficially along the external jugular vein and deeply along the internal jugular vein as the internal jugular chain, further subclassified into upper group, the middle group and the lower group, and then the spinal accessory chain, which is along the spinal accessory nerve, the transverse cervical chain, which is the actually the supraclavicular group of lymph nodes. Out of the this deep cervical group of lymph nodes, two groups of lymph nodes, two nodes are specifically well known, the jugulogastric and the jugulo-omohyoid. So if you see in a patient, you can very well examine the sternocleidomastoid. So first you see the sternocleidomastoid, and just deeper to it is the and sternocleidomastoid, and just deeper to it passes the internal jugular vein. So below the posterior belly of the digastric, between the angle of the mandible and the anterior border of the sternomastoid. So if you see the angle of the mandible and the anterior border of sternomastoid, you palpate in yourself angle of the mandible and the sternocleidomastoid, and just below the mastoid process, little bit below, if you see there is any group of lymph node in a patient, then it is jugulogastric group of lymph node. So in you this would not be palpable, but I'm just telling you the location, angle of the mandible और anterior border of the sternocleidomastoid में आप थोड़ा सा नीचे जाके examine करेंगे तो ये jugulogastric group of lymph nodes है. Then the jugulo-omohyoid group of lymph nodes, it is behind the internal jugular vein under cover of sternocleidomastoid. तो ये under cover है, तो inferior belly of omohyoid के ऊपर और internal jugular vein के पीछे, posterior to the internal jugular vein and superior to the inferior belly of omohyoid under cover of sternocleidomastoid, you will find the jugulo-omohyoid group of lymph nodes. So actually the lymphatics from all these lymph nodes finally reach to the jugulogastric, and even finally it reaches to the jugulo-omohyoid, and then they form the jugular trunk, and then they are further drained to the thoracic duct or directly to the internal jugular vein and further. Now, if you see these lymph nodes, just jugulogastric, see, you must have heard about the tonsillitis, tonsillar carcinoma. Some of the structures, like mainly the tonsils, they drain specifically to the jugulogastric lymph nodes. And the tongue is, the carcinoma of the tongue is quite common. This drains chiefly to the jugulo-omohyoid group of lymph nodes. Now the spinal accessory chain. This lies along the spinal accessory nerve in the posterior triangle, and this drains the scalp from the back, skin of the neck, the nasopharynx, the occipital and the postauricular group of lymph nodes. Lymph from there, the efferents pass to the transverse cervical chain, which is the supraclavicular group of lymph nodes. They lie along the transverse cervical vessels, which are derived from the subclavian artery. You see in the posterior triangle, आपने देखा था subclavian scalenus, this anterior और medius के बीच में आपका क्या निकल रहा था, brachial plexus और subclavian artery. तो subclavian artery से ये vessels निकलते हैं, transverse cervical vessels. इसीलिए इन lymph nodes को medial part sites, medial group of these lymph nodes are also known as scalene nodes because of their relation to the scalenus muscles. So afferents to these groups come from the accessory chain, as we discussed, and also from the infraclavicular structures like breast, lung, stomach, colon, ovary and the testis. So if the left supraclavicular group of lymph nodes is enlarged, it is of very clinical significance that It can be a case of carcinoma stomach or carcinoma testis and carcinoma ovary. So whenever you find the group of cervical group of lymph nodes is enlarged, okay, you will think of tuberculosis, you will think of some congenital anomaly, you can think of in an old patient of some carcinoma also, with other associated symptoms. But if the left supraclavicular is enlarged, you should go for the investigations related to the stomach and the testis also. Like you will do the ultrasonography of the abdomen for ovary in a female patient and for the stomach, and then you will examine the testis. The lymph node you found enlarged is the supraclavicular, but you will do the complete examination of the patient. Now the anterior cervical group of lymph nodes, they lie along the anterior jugular vein, which is, these are not very much clinically much important. Then there is juxtavisceral chain, which is related to the viscera present in the neck, that is the larynx and the trachea. And they drain the respective structure. Like the prelaryngeal group of lymph nodes lies on the cricothyroid membrane and drains the subglottic region of larynx and piriform sinuses. Pretracheal group of lymph nodes drain thyroid gland and the trachea, and the paratracheal drain the thyroid, subglottic larynx, and the trachea and cervical esophagus. What is Voldier's tonsillar ring? So as the name implies, you must know, what is tonsil. Now Voldier's tonsil ring, that is the pharyngeal lymphoid ring. The more technical name is pharyngeal lymphoid ring. So now you can understand it must be around the pharynx. It must be around the pharynx. So a ring of lymphoid tissue surrounding the nasopharynx and the oropharynx is known as Voldier's tonsillar ring. These lymphoid tissues are present around the nasopharynx and the oropharynx, and collectively they form the Voldier's ring. So mainly the Voldier ring is has the lymphoid tissue surrounding the nasopharynx. So what are the lymphoid tissue which surround the nasopharynx? See, this is the pharyngeal portion. You see, this is tongue. This is tongue. So this is the posterior part of the tongue. So these are the lingual tonsils. These are the tonsils, palatine tonsils, which you must be very familiar. Tonsils आपने देखे होंगे अपने. तो ये जो पोर्शन यहाँ से आया, ये तो ओरोफेरिंक्स का में पहुंच गए हैं आप. तो lymphoid tissue surrounding the oropharynx are the lingual tonsils in the posterior 1/3 of the tongue and the palatine tonsil on either side of the oropharynx. इनके बीच में भी कुछ subepithelioid lymphoid tissue होता है which denotes the malt mucosa associated lymphoid tissue. ये सब आपस में connected हैं. तो ये तो हो गया oropharynx का portion. और जो nasopharynx के around जो lymph nodes हैं, एक तो adenoids कहते हैं उनको, adenoids, and दूसरे हैं tubal tonsils जो कि स्टिचियन ट्यूब जो pharynx में ओपन करती है उसके अराउंड जो those lymph nodes which are present around the opening of the Stichian tube, those are the tubal tonsils. So these are the lymph nodes around the adenoids, and the tubal tonsils are found around the nasopharynx. So these collectively, so if we start from anteriorly, lingual tonsil, palatine tonsil, tubal tonsil, adenoids. Adenoids, tubal tonsil, palatine tonsil, lingual tonsil. They are forming one ring of both sides collectively, and they are interlinked to each other because there is scattered lymphoid tissue present in between also. So they are all interlinked to each other. So they are forming an inner ring, and the lymphoid tissue from these efferents from these lymphoid tissue pass to the superficial ring, that is in the submental group of lymph nodes or submandibular group of lymph nodes or the jugular chain of lymph nodes or the jugulo-digastric lymph nodes, and posteriorly from adenoids to the retropharyngeal group of lymph nodes. So all of this is interlinked. Now that is the Voldier's ring. So it has an inner ring and it has an outer ring. Inner ring is by the lingual tonsil, the palatine tonsil, the tubal tonsil, and the adenoids. The outer ring is by the deep cervical group of lymph nodes, the other group of lymph nodes. So that is the Voldier's ring. What is the function of the Voldier's ring? See, you must be knowing what is the function of the tonsil. Tonsil का क्या function होता है? Protection. They protect antigens from the जो आप खाते हैं और जो इन्फेक्शन जो जाता है, तो एंटीजेंस दे आर एनगल्फ्ड बाय द टॉन्सिल्स. सो सेम as you breathe in the inspired airs, if there is any antigen is present, then it will be trapped by the adenoids and the tubal tonsils, and then these in turn stimulate release of immunoglobulins by the B lymphocytes. The similar is the function of of the lingual and the palatine tonsil. See, आपने सुना होगा, कहते हैं मुंह खोल के मत सो. पेरेंट्स मना करते, भाई मुंह खोल के क्यों सोते, मुंह बंद करो, नाक से सांस लो. तो जब आप मुंह से सांस लेते हैं तो और इन्फेक्शन चला जाता है, और ये जो पूरा सांस नाक से भी जा रही है, मुंह से भी जा रही है, देन इन दैट केस दिस all these lymphoid tissue get enlarged. Okay, so adenoid, क्योंकि आप का मुंह खुला हुआ है तो ये आप एंटीजेंस जा रहे हैं, तो आप एडेनोइड, ट्यूबल टॉन्सिल, लिंगुअल, पैलेटाइन टॉन्सिल, ये सब आपके एनलार्ज हो जाएंगे. मेनली ऐसी कंडीशन में देखते हैं एडेनोइड टिश्यू बहुत एनलार्ज हो जाते हैं, इसीलिए कहते हैं मुंह बंद करके सोना चाहिए. सो एंड how is the effectivity of, because these are very small in size, so how is the effectivity is increased? So the mucosa of these tissues, these lymphoid tissue, has many folds, they have many crypts, so as to increase the surface area of the mucosa covering the tonsils or the other lymph. You can see this is around the nose, adenoids, the tubal tonsil, and this you can see the palatine tonsil and the lingual tonsil, and you can see there are so many folds in it. Okay, so this is what is the purpose? This will increase the surface area of the mucosa, and so they will be better equipped to catch or the trap the antigen and protect. Now, efferent from all these group of lymph nodes from the head and neck. So they will, from superficial group, they will go to deep group, and then they form the jugular trunk. And on the right side, this jugular trunk will directly open in the junction of the internal jugular vein and the subclavian vein, while on the left side, this jugular trunk joins the thoracic duct. So this all whatever we discussed was the anatomical classification. Now, while in the clinical practice, you discuss the lymph nodes present in the neck in terms of levels. See, because it is not very much when you are examining the patient from outside. Now, it is not very clearly demarcated. Like if the submental group of is enlarged, okay, but submandibular group का lymph node जो कि थोड़ा सा submental की side है, so you will be confused whether it is submental or whether it is submandibular, and similarly you don't know. So we describe it in the clinical practice or in the surgical practice, we describe it is in the level. So if this horizontal group above the hyoid bone, ठीक है, hyoid bone के ऊपर सबमेंटल सबमेंडिबुलर कोई lymph node आपको ये enlarge दिख रहा है in the neck, this will be the level 1. ओके, सबमेंटल एंड सबमेंडिबुलर. लेवल सबमेंटल दिख रहा है तो आपने 1A कह दिया, सबमेंडिबुलर आपको लग रहा है 1B कह दिया, ठीक है, 1A 1B. ओके, देन द along the internal jugular vein, तो इसको 3 पार्ट में डिवाइड किया, अपर 1/3, मिडिल 1/3. सो अपर 1/3 इज अपर जुगुलर लेवल 2, middle 1/3 or middle jugular is level 3, lower jugular is level 4. So level 1 submental 1A, submandibular 1B, level 2 is upper jugular, level 3 is middle jugular, level 4 is lower jugular, level 5 is the posterior triangle, maybe it is around the spinal accessory or the transverse cervical chain, the supraclavicular group of lymph nodes. And the level 6 are these below the hyoid, the prelaryngeal, the pretracheal and the paratracheal group of lymph nodes. And the level 7 are the nodes of the upper mediastinum, that is in the suprasternal notch, and include nodes of the upper mediastinum. So that is the surgical classification. So when we ये मेटास्टेसिस की क्लिनिकली जरूरत कहाँ पड़ती है, तो इन्फेक्शन में आपने ट्यूबरक्लोसिस का दिखा, दूसरा अगर कोई मैलिग्नेंसी है तो उसका मेटास्टेसिस. सी इन इंडिया द कार्सिनोमा ऑफ द चीक इज वेरी कॉमन, द कार्सिनोमा ऑफ टंग इज ऑल्सो वेरी कॉमन, तो कार्सिनोमा माउथ इज वेरी कॉमन. तो इसका जब मेटास्टेसिस हुआ तो आपको अगर मेटास्टेसिस बताना है तो आप ये बोलोगे कि कौन से ग्रुप का लिम्फ नोड एनलार्ज है. तो इफ इट इज जस्ट लेवल 1 इज नॉट एनलार्ज, so you can understand, okay, it is a very early stage, no lymph node is enlarged, that means palpable to the extent of the palpation. So that means that it is of very early stage. So prognosis is good. But if level 1 is enlarged, you say no, level 2 is also enlarged, that means the metastasis has, the severity has increased. Spread is uh, further occurred. Now if it is level 3, it is level 4, level 5. So this describes the level of the involvement of the lymph nodes. So आप ऐसे बताओगे level 2 involved हुआ है. So that is the significant surgical classification of lymph nodes of neck. Now the applied anatomy, as we discussed, deep cervical lymph nodes get enlarged in tuberculosis and malignancy. See, tuberculosis is very common in India, that too in Uttar Pradesh and that too in Kanpur. तो आपके पास पेशेंट आएगा, गांठें हो रही हैं, बच्चा आया, उसके खूब सारी नेक में गांठें हो रही हैं, उसको कोई ज़्यादा दिक्कत नहीं है, वो बच्चा खेलता है ना, लेकिन उसकी मदर लेकर आती है. So you will think, okay, this could be a tuberculosis. You will investigate. You will ask for the appetite of the patient. You can do the biopsy of the lymph node, and then you can treat him. अगर आप नहीं treat करेंगे तो वो further बहुत serious हो जाएगा. It will further complicate. Similarly, in some malignancies are there, like Hodgkin's lymphoma, blood cancers in easy terms. In that also, the deep cervical group of lymph nodes are typically enlarged. Now, jugulodigastric and jugulo-omohyoid we discussed. Then spinal root of accessory nerve. So while the lymph nodes are enlarged, like we discussed the spinal accessory group of lymph nodes. So if you are taking the biopsy of the deep cervical group of lymph nodes, you should remember that spinal root accessory nerve is there. It is, if you can recall, it is around middle of the sternocleidomastoid, posterior half of the middle sternocleidomastoid. वहाँ पर होती है ना, तो आप ये देखोगे कि यहाँ पे स्पाइनल रूट एक्सेसरी नर्व आप डैमेज ना कर दें while you are taking the biopsy. Now left supraclavicular group of lymph node, also known as Burkitt's lymph node, and it may be a pathognomonic sign of the, or the alarming sign for the carcinoma tongue or the carcinoma testis or carcinoma ovary. Now while you do the block dissection of neck, if you find a patient in which many of the lymph nodes are enlarged, is a serious stage, it was, so what will you do then? Besides you are removing the tongue, or besides you are removing the mandibular carcinoma, you will remove all the cervical lymph nodes. Even internal jugular vein is removed. The sternocleidomastoid muscle is also sacrificed. Even 11th nerve is removed. All these are removed to prevent the further metastasis. अगर किसी lymph node में infection spread हो गया है और आपने उसको remove नहीं किया, so even after if you have done the surgery, the metastatic cancerous cells are present in that lymph node and they will spread to the body. So you have to do a vigorous surgery. There is a modified radical neck dissection is there. If possible, what we do, we remove the lymph node. That is must. But we try to protect the carotid artery, carotid artery, the vagus nerve, the 12th nerve, sympathetic chain, and accessory nerve is protected. Suppose if accessory nerve is damaged, then what will happen? There will be the shoulder drop in the patient. Now these structures we try to preserve as much as possible. Now this is the examination of the neck nodes. You can see the clinician is standing posterior to the patient, and while you examine the patient should be relaxed so that he does not tightens his muscles, because if we just discussed that the lymph nodes internal jugular vein is located posterior to the deep to the sternocleidomastoid. So if sternocleidomastoid is taut, you cannot examine the deep cervical group of lymph nodes. So it has to be relaxed. So your neck is slightly flexed to achieve the relaxation of the muscles, and then we will find the we will decide what is the location, like 1A, 1B, level 2, level 3, level 4. Consistency, if they are elastic or they are hard, they are shorty. So that is the consistency we observe. We observe the size, if they are very small, less than 1 centimeter or more than 1 centimeter. This is all signify the severity, staging of the carcinoma. And symptoms, if these are painful or these are not painful. If the lymph nodes which you are examining are discrete from each other or they are matted to each other. अलग अलग है कि ऐसा लग रहा है जैसे क्लम्प बन गया है, that is also a sign of a severe metastasis, severity of the staging. Here you can see the different groups are being examined. Can you find out? This is submental, this is submandibular group, this is preauricular, this is postauricular, this is occipital group of lymph nodes, and this is the jugular group of lymph nodes, deep cervical group of lymph nodes, and this is the supraclavicular group of lymph nodes being examined. So this topic which we covered today, the lymphatic drainage of head and neck, is of very importance in the clinical practice. This is very important while you are in the clinical practice. So thank you so much. Have a nice day.